Hello, this is Dr. Bouvier with Doctor and You. You came to this video to learn a little bit more about trauma and follow-up from trauma. Now, as paramedics and people working in the ER, I understand you understand about trauma. But in this setting, as a primary care paramedic or a nurse practitioner or a family doc in a follow-up from an accident, it's really important some of the things to know about. And you're 46 years old. By the way, it's okay to show this to our students and stuff on YouTube.
Yes.
And stuff. Okay, yeah, I appreciate that. So he had the misfortune of having a quarter-ton truck come off the jacks, half-ton truck come off the jacks, hit him on the chest, hit him in the ankle, and he didn't break anything miraculously enough, but he had this so-called soft tissue injury. So go ahead and stand up. So 3 days after the accident, this is what shows up, right? So this didn't even show up to begin with, and you pelvic rock, and he doesn't even have any pain. But what happened was this flank area and stuff, and the deep core tissues had soft tissues damage. So we know that his psoas or quadratus lumborum, go ahead and sit down, quadratus lumborum, or one of those deep tissues there, a hip flexor, was damaged, right? And now it has to have time to heal. He's got a little pain when he raises his foot and when he bends, and right along from the mid back all the way down to the end of the spine, he's got some pressure and some pain, but no radiculopathy. So you have to watch out for these things, and this is why we see trauma patients back within 24 hours. I try to see them back a week later, and then maybe 10 days later as well, sometimes 2 weeks, depending on how they're feeling. And the follow-up is incredibly important. Some of the treatments that we do, I try to stay away from aspirin and NSAIDs like ibuprofen, but I do use a homeopathic blend of arnica, montana, and some pills of that sort of thing. If you want to learn more about that, then email me and we can have a conversation about that. But these trauma patients, we have to be very careful in the follow-up, because he could have a retroperitoneal hematoma and us not know about it, but that's something we should track for the next few months. So his initial CAT scans were negative of his chest, abdomen, neck, head, pelvis. But at some point we're probably going to repeat that with special attention to the retroperitoneal area for soft tissue hematoma. Just got to remember those things when you're doing a workup and follow-up for major trauma. This is blunt, low-impact trauma. Again, this is Dr. Robert Bouvier with Doctor and You. Thank you very much. Appreciate that. Absolutely love your shirt. Take a look at this shirt, man. Guns N' Roses, yeah! Take care.